who requested a public hearing on this important subject affecting all Iowans. I am Midge Slater, representing the Iowa State Council of the Communications Workers of America and a retired CWA staff representing our members in Iowa. For more than 13 years, I negotiated contracts, all of which contained health care provisions. We know the difference between a good and a bad proposal. I can assure you that if I had brought to the table with our members a choice such as we have before us tonight, with the recommendation that they vote for the option that costs more, covered fewer people, provided less service, and was punitive in nature, rather than the option that was paid for, covered more people, and included more in the way of services, that would have been the last contract I negotiated for them. Our members get this issue. We also know that money, when it's left on the table, is money that is gone, to be used by someone else for their purposes. The fact that other states would have access to the dollars intended for Iowa is unacceptable to us. We know when something is the right thing to do, because we have fought long and hard to obtain and maintain wages and benefits that enable us to care for our families and ourselves. We understand that not everyone in our communities has that opportunity, particularly those with the fewest resources available to them: seniors on a fixed low income, people with disabilities, children, and members of our own families. It is irresponsible not to accept an opportunity such as this one provided to us through the Affordable Care Act, our national health care plan. With more people covered, we know that fewer will have to rely on the emergency room for treatment, and those venues will be more available for emergency care, that for which they are intended. This should not have taken so much time and so much energy. We have too many other concerns to spend this much time on an issue that has already been resolved. Let's get on with it, recognize the will of the majority of the people of Iowa, pass Senate File 296, and make Medicaid expansion a reality in our state. Thank you.
Thank you. Next is Jan. Please, if we could not applause during the hearing so we can get to